Do4 is on the posterior midline, below the spinous process of L2. Do14 is on the posterior midline, below the spinous process of C7 in a depression. Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle. Rim 12 is 4 cm superior to the center of the umbilicus on the midline. Rim 15 is 7 cm superior to the center of the umbilicus on the midline.
Rim 24 is on the anterior midline in the center of the mentolabial groove. Do16 is located on the posterior midline at the base of the occiput. To find the base of the occiput, palpate down to about 1 cm superior to the posterior hairline. If you rock the head backwards and forwards very gently, you should be able to feel the cleft between the base of the occiput and the spine. Make sure you mark this point directly on the posterior midline. Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cm posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other do points, so don't be tempted to go further back than 1 cm posterior to that midpoint.
Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the two tendons palmaris longus and flexor carpi radialis. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between two tendons, palmaris longus and flexor carpi radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpi radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again. Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpi ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed.
Lung 3 is 3 sun inferior to the anterior axillary crease, in between the lateral borders of biceps brachii and the shaft of the humerus. In relation to large intestine 14, it's slightly anterior and inferior to it.
Stomach 36 is located approximately 13 sun superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 sun inferior to the inferior border of the patella. Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus.